Hello, my name is Safa Larasabi. I'm one of the OBGYNs at the Niagara Falls Memorial OBGYN Center. I am originally from Central Washington. I grew up in a small town called Yakima, very similar, honestly, to Niagara Falls and the area around it. I went to medical school at the Pacific Northwest University of the Health Sciences, also in Central Washington. Did my residency in OBGYN at St. John's Episcopal in Far Rockaway, Queens. And then moved here afterwards because my wife and her family are also from this area and we were looking to settle down. Although it may seem strange to come see a doctor when you're not feeling ill, there are a lot of things that we can do to help people at every stage of their life. So, for younger people, the conversations that we have typically revolves around, like where you are in your personal journey of having a family. We also offer a variety of screening tests for different types of infectious diseases or STDs, depending on the situation. There are immunizations that can be given that will help reduce your risk of cervical cancer, so we talk about those as well. And then, just in general, like we check in and make sure that everything is going okay, not just with your period, but with your other medical issues that you may be experiencing. So as people move into their 50s, often they will begin to experience menopausal or perimenopausal symptoms. Menopause is just a term for when someone has not had a period for more than a year, but some of the symptoms that surround menopause can happen many years before that. Many people will experience hot flashes or itching or burning, in that particular part of their body, or have pain during intercourse. Again, fortunately, there are a lot of things that we can do to help with that, and so we just encourage people to come in and talk to us when they feel comfortable. Seeing your GYN shouldn't end at menopause, particularly because as you get older, it can become more common for cancers to develop. And so even after menopause, we'll continue to see people to make sure that their bones are strong and that they're getting the vitamins that they need and minerals that they need to keep them strong, but then also screening for breast cancer, cervical cancer, and sometimes ovarian cancer continues. So we encourage people to continue to see us. The most important thing for me when someone comes in for an annual visit is to make sure that if they're having an issue or a problem and there's something that I can do that will make it better, that we're able to provide that service to you. We can discuss good habits for healthy bones, what's necessary for a healthy lifestyle, and also what kind of treatment options are available when you have very common infections of the bladder or down below. We also discuss your menstrual as the sixth vital sign and make sure that you're having a regular, normal flow. And if there is an issue, there are a lot of things that we can do to help.